Hello, Akhil.
Yes, sir.
Yeah, you can invite all the regular students. Tell them this is a very special session. Okay.
Yes, sir. Okay,
Part
sir.
C listening, especially for exam going students this month and next month.
Yes,
Yeah.
sir. Okay.
Yes. Cholesterol, Dr. Petro Everall. Yeah. So this is the first question. Go through this question, please. Dr. Everall thinks misunderstandings about the role of cholesterol largely arise due to. Okay. Dr. Everall thinks misunderstandings about the role of cholesterol largely arise due to is missing. Okay, right. Go through this question. Think about this. No need to do 10 questions or 20 questions. Just try to consider this one very clearly. Dr. Everall thinks misunderstandings about the role of cholesterol largely arise due to. Misunderstanding due to. So you have to think about this. Okay. Yeah. So study this question very clearly. Yeah, one by one students are coming. Very good. Okay, that's really fine. Thank you, Akhil. You are doing a good job. Tell the others also. Yes. Dr. Everall, very good. Dilip has joined. Okay. Dr. Everall thinks misunderstandings about the role of cholesterol largely arise due to cholesterol is not a problem. But here, okay, you can see very clearly, right? Now the question is here. Misunderstandings. Misunderstandings. Misunderstandings due to means because of cause and effect relationship. Cause and effect relationships. There is something because of that there are misunderstandings coming. So cause is that something, and now there are misunderstandings. Okay, misunderstanding because of something, right? An imprecise use of the term in the media. So media is the problem. Media is the problem because it is using imprecise, means incorrect. Okay, imprecise. Precise means unlimited edition, not limited edition. Precise means perfect. Imprecise means not very clear. Okay. Inadequate explanations by health professionals. Here the problem is health professionals. They are not explaining properly. A lack of focus on its positive influences in research studies. Research is the problem here. So is it because of the media, or is it because of the media? Media is using it imprecisely. Media is using the word, the cholesterol, imprecisely. So problem with the media because media is wrong usage. Then health professionals, so imprecise, not precise use. Inadequate explanation. Explanation is inadequate. Okay, right. A lack of focus. Lack means negative of focus on its positive influences in research studies. So here you can say very clearly. Why is that screen is not clear, Dilip? Dilip, you have a network problem maybe. So a lack of focus on its positive influences in research studies. You can see here. Okay, now go through these questions. Vincent. Okay. Vincent, Kerala. Okay. Vincent, சொல்லு. Vankra. Yeah. So just a study of these things now. So here media is a problem because media is wrong, imprecise. Here health professionals problem because they are giving inadequate or insufficient information. Here research is the problem because there is lack of focus. There is lack of focus. So this is how you have to analyze this question. Okay, now let us see here. I'm going to play the audio.
Occupational English test.
Well, the benefits definitely outweigh any risks.
So how can I help you?
My big toe's very...
Which fits best according to what you hear. End of Part B. Now look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B or C, which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1. Extract 1. Questions 31 to 36. You hear Dr. Pietro Everall giving a presentation on the subject of cholesterol. You now have 90 seconds to read questions 31 to 36.
My name's Pietro Everall, and my presentation is about cholesterol. And it's a fascinating, if rather complex, topic. And that probably accounts for why, amongst our patients, there's a lot of misunderstanding about the role of cholesterol and about when and why it represents a health issue. To my mind, this largely results from the rather loose use of the word, particularly by journalists and others, that leads to cholesterol being perceived as a bad thing in the patient's mind. As doctors and nurses, we have to find a way of telling our patients exactly what cholesterol is, in simple terms, and why it's important, and that means going back to the basic science. It's long been established that cholesterol, by helping to move fat around the body, taking it to the organs that need it, is essential for health, that without it, the body wouldn't be able to function. But when it becomes oxidized or damaged, cholesterol can...
So now, yes, we have completed this question. So there is a question that's finished. Okay. So now this question, we are going to answer this question. Print a screen. Yeah. Yeah. So here is the question number 1. Yes. Question 31. Question number 31. Yes. Now this question number 31. Yeah. Question 31. Yeah. Submit your answer. 7, 6, 5, 4, 3, 2, 1. Submit your answer. Yes, you can submit your answer. Anita says C. Anju says B. Come on. Dilip says A. Come on, what about the rest? What about the rest? Yeah. Now let us check. Now let us check this one. I'll give you the right answer now. Here. You can check. Yes. So the right answer is here. Create poll. So the audio, what I can say, audio where I can give you. Okay. So we can give the link here, audio. So YouTube. Yeah. Where is that? Yes. Here it is. Okay. Yeah. So now let us check this one. Yeah, the answer is here. Right. Create poll. A, B, C. And this is logical reasoning approach. Logical reasoning approach. Yeah. Logical reasoning approach. So you can check your answer now. Copy, post a link. Copy, post a link. Okay. Copy, post link. Yes. Yeah, it is working. Telegram is working, Dilip. It is working. But you have to find out some solution for that. Okay. Now this is the point here. Now I'm going to give you the text. Okay. Script. Yeah. Go through this script now. Yeah, here is cholesterol. This is the first part. And here is the second part. Yeah. So in this paragraph, you will get the information. Go through it 1 minute. And you will try to get the answer from there. And check whether why it is right. Give your explanation in your tab. Yeah. So you can see here very clearly now. Okay. I'll give you the explanation. I told after the delivery. Yeah. Yes, very good. Now, if you see very clearly here, to my mind, this largely results from the rather loose word used loosely, not strongly. So it is talking about the usage of the word cholesterol by journalists. By journalists. Try to understand this. So, right. To my mind, this largely, what largely, let us see here. Misunderstanding is here. So misunderstanding is actually here. And that probably accounts for why amongst our patients. Okay, let me give it from here. Actually, I think I should give you both of them together. Okay, how can I bring both of them together? Okay, I think I can bring both of them together. Okay. Yeah. Yes, these two things we can take together. Okay, let me take this one. Okay. Right. Okay. Now it's clear. I'm doing something so that I can bring them together for you. Okay. Yeah. That's it. Now it's very clear for you. Okay. Yeah. And that probably accounts for why amongst our patients there is a lot of misunderstanding about the role of cholesterol. Okay. And why it represents a health issue. Yeah. To my mind, this means this misunderstanding largely consequences due to results from. Remember that due to and results from. Due to means because of means results from. Okay. So the rather loose use of the word loose, that use the word loosely without any strong conviction. They just talk like that nonsense. Rather the large rather loose use of the word. What is the word cholesterol? What is the word cholesterol? So that's it. Particularly by journalists. Particularly by journalists. Yeah. Now you understand the point very clearly here. Okay. So this means misunderstanding. Word means cholesterol. Okay. Right. Results from this misunderstanding. This means misunderstanding results from the loose use of the word. So you can understand everything very clearly now. You can understand very clearly, right? Especially by journalists. They're so clear. Very, very clear. So use of the word by journalists. Loose use of the word by journalists. So this is the way. This is the way how you have to find out or track the answer. Okay. This is the way. Loose use. Okay. Loose use by journalists. This here is the clue. So if you can understand this one very clearly, it's very easy for you. Otherwise, it is a tough time. Loose use of the word by journalists. Result is this. It is because of. Results from means because of. The rather loose use of the word. Remove results from and put a due to. This misunderstanding is largely due to the rather loose use of the word. That's it. Loose use of the word by journalists. That's it. That's so simple. Print screen. Rectangle. Yeah. This is the explanation. And here, synonyms are very crucial in decoding the answer. Synonyms are very crucial in decoding. And the activity, okay, the puzzle can be solved. The puzzle can be solved, definitely. Why? Because it is cause and effect relationship. So the decoding factor is due to means results from. Due to means is equal to or results from. This is the secret. Due to means results from. That is how you will find the answer. If you understand that this explanation is very crucial and you got a clear technique of understanding this question, then give a yes. If the understanding, so the answer is, yeah, you can see there. Nah? You can see there, the answer is A. Right. So an imprecise use of the term in the media. Media means journalists. Media means journalists. Media means journalists. That's it. Next, we'll move on to the second question, 32nd question. Now, update your scores, please. Update your scores, please. 1 by 1 or 0 by 1? 1 by 1 or 0 by 1? One by 1 or 0 by 1? Okay. Yes. So, was the explanation beneficial? Okay, first one is, was the explanation beneficial? If it is yes, then what percent? 0. What percent? 0 to 100. 0 to 100%. What percent beneficial it is? Yeah. நாளை அகில் தெரியும் தெரியல அகில் தெரியும் நாளை அகில் வரும் ஓகே அது தெரியல அகில் வந்து ஓகே நாளை yeah, so please be generous enough to just tell how much it is useful for you so that I can give more. If it is not useful, then we'll shift. Na? So Matsepo, Anita, Anju, 3 people have said that it is useful. And out of 10 people, 3 people told. That means 30% only think that it is useful. Others, they feel that it is not useful. So what we'll do is, we'll, instead of doing 10 questions, we'll do only 40 questions. Why should 4 questions? Why should we do 10 questions? Because it is not useful, right? Okay. So 1, 2, 3, 4, 5 students. Dilip, Vijay, Anju, Anita, and Matsepo. So we'll do 5 questions because 5 students told me. So we'll do 5 questions. Yeah, now 30. Yeah. 30. Yes. Second question. Go through this question now. Go through this question now. So Dr. Everall feels that using the words good and bad, good cholesterol and bad cholesterol, the words good and bad. Okay, the words good and bad cholesterol. Now, what do you mean by this good and bad? Why is he telling good and bad types of cholesterol? Okay, good and bad types of cholesterol. So why is he relating these two things, good and bad cholesterol? We know the topic is cholesterol. Why is he talking about good and bad regarding cholesterol? Why is he talking about good and bad regarding the types of cholesterol? Feels that, what does he feel? What does he feel? What are his feelings? What are his opinions regarding the words good cholesterol and bad cholesterol attached to cholesterol? It may be a useful way of clarifying a key point for patients. So useful way of clarifying key points for patients. Okay. So it is useful way for clarifying a key points. Clarification. So if you say good cholesterol and bad cholesterol, confusion is cleared. Clarification means avoid confusion. Clarification, that means everyone will know everything about cholesterol. Good cholesterol means good, bad cholesterol means bad. That means bad cholesterol is not wanted, good cholesterol is wanted. So like that you have to check. Like that you have to check. So this is how you can think about this good cholesterol and bad cholesterol. Good cholesterol and bad cholesterol. Now let us see. Could encourage patients to find out more. Could encourage patients to find out more. So here, find out more. To find out more. What do you mean by to find out more? Means gain knowledge. To gain knowledge. Find out more means to gain knowledge. Okay. Find out more means to gain knowledge. That's the point there. The next one. Might lead patients to underestimate. Underestimate means give less value, ignore the complexity of the subject. So here, this is a negative point. This is a negative point. This is a positive point. And this is a positive point. So 2 positive and 1 negative. So now let us see. Dr. Everall feels that the words use good and bad to describe types of cholesterol. So he thinks that it is useful way to clarify. Many misunderstandings will be cleared. Good cholesterol means it's okay, no problem with that. Bad cholesterol means it's not okay, it's not good for the patient, like that one. They will understand and they will have a little bit of idea to differentiate between different types of cholesterol and what to avoid and what not to avoid, when to take care and when not to take care, when should you leave them or when should you be behind them. Okay, what type of treatment should, so they will get a clear picture. Next, number 2, B, could encourage patients to find more about the science. So when you tell good and bad, it will encourage patients to find more. That means they want to gain more knowledge. They want to gain more knowledge, and patients will be encouraged they to find out more information about the science of cholesterol. So that's what he's telling. So next one, might lead patients to underestimate the complexity of the subject. So the subject is very complex actually. Cholesterol, information regarding cholesterol is very vast. And if you just bring it into 2 groups, good and bad, they will misunderstand, they will underestimate, they will ignore the importance, the seriousness of the subject. That's what he says. So now let us see. Let us listen to the audio and get back to this. Okay. Question number 32. Question number 32. Okay.
My name's Pietro Everall, and my presentation is about cholesterol, and it's a fascinating, if rather complex, topic. And that probably accounts for why, amongst our patients, there's a lot of misunderstanding about the role of cholesterol and about when and why it represents a health issue. To my mind, this largely results from the rather loose use of the word, particularly by journalists and others, that leads to cholesterol being perceived as a bad thing in the patient's mind. As doctors and nurses, we have to find a way of telling our patients exactly what cholesterol is, in simple terms, and why it's important, and that means going back to the basic science. It's long been established that cholesterol, by helping to move fat around the body, taking it to the organs that need it, is essential for health, that without it, the body wouldn't be able to function. But when it becomes oxidized or damaged, cholesterol can contribute to the buildup of plaque in the arteries, increasing the risk of heart disease and stroke. So we often talk to patients about good and bad cholesterol as a way of avoiding more technical definitions. Because there are different types of cholesterol particles. For example, low-density lipoproteins, often called LDL particles, are more likely to become oxidized and contribute to buildup of plaque, whereas larger, high-density or HDL particles are less likely to, So the labels good and bad, although simplistic, can help patients to see that we need to look at the whole picture, rather than just focusing on the total amount of cholesterol in the body. And also that advanced lipid testing is important, because it gives us information about the different types of cholesterol particles and helps us identify patients needing treatment. But patients can be reluctant to engage with the issue of cholesterol. As we know, when it comes to treatment, early intervention is key, but patients don't always see this. One thing they find hard to grasp is that although they feel perfectly fit and healthy, high cholesterol can be building up inside blood vessel walls, narrowing them and reducing blood flow to the heart and brain, thereby increasing the risk of cardiovascular problems. That's why it's imperative for those in high-risk groups, essentially men over 45 and women over 55, to have regular blood tests to measure not just the total amount of cholesterol in the blood, but also levels of HDL, LDL and triglycerides, a fatty substance similar to bad cholesterol. And preventive medicine has a key role to play here. It's estimated that 60% of adults in high-risk age groups have...
Yeah. Now you should know the difference. Now I'm going to give you the options. Question. So 5 students said yes, it is useful. Okay. So 1, 2, 3, 4, 5. 6 students said it is useful. So we'll go through 6 questions only. Okay, question 32. So we'll go through 6 questions. Right. Then, now submit your answer. 7, 6, 5, 4, 3, 2, 1, and submit. Submit your answer, please. Yeah. So that's it. You can check your answer now. Copy, post link. You can check your answer and then update scores, please. Yes. Update scores, please. Now let us go to the yeah, here it is. Here it is. So we often talk to patients about good and bad cholesterol as a way of avoiding more technical definitions, because these are different types of cholesterol particles. For example, low density lipoproteins, often called LDL, are more likely to become oxidative. So the labels good and bad, although simplistic, can help patients to see that we need to look at the whole picture. They help the patients to see that we need to look at the whole picture rather than just focusing on the total amount of cholesterol in the body. And also that advanced lipid testing is important because it gives us information about the different types of cholesterol particles and helps us identify patients needing treatment. See here, you can see very clearly. Okay. So we often talk to patients about, okay, good and bad cholesterol as a ways of avoiding more technical definitions. Try to understand this one. Okay. Right. So here, rather than just focusing on the total amount of cholesterol in the body, he's telling you, he's just clarifying that these type of cholesterols are good, okay, and low density protein lipoproteins, often called LDL particles, more likely to become oxidized and contribute to buildup of plaque, whereas large high density of HDL particles are less likely to. So although simplistic, these labels, good and bad, are simplistic. They can help the patients to see, they can help the patients to see, they can help the patients to see that we need to look at the whole picture, that we need to look at the whole picture rather than just focusing. Yeah. So, and also that advanced lipid testing is important. See here, it gives us information about the different types of cholesterol particles. You can see here, and helps us identify patients needing treatment. So just be very clear here. Okay. So this label, good and bad, is talking about good and bad. It is very simple and it is helping the patients. It is helping the patients to see. To see means to see and understand. To see and understand, that is not just focusing on the total amount of cholesterol in the body. You have to just see whether it is good cholesterol or bad cholesterol. Don't see fat as fat. If it is, okay, harmless, no problem. There is something called good cholesterol, that is not a problem. But if it is bad cholesterol, then you have to take action. That's what it is indirectly telling. It's clarifying a key point, that harm and harmless. The differentiate between harmful and harmless. If there is harm, it is harmful. There is no harm, it is harmless. That is how you have to clarify. Okay, fine. Now let us see. This is the point. Right, now let us move to the 33rd question. So update your scores. You have updated? I told update scores. Nobody updated. Only one. Anita wrote 1/2. What about the others? Huh? What about the others? How do I know that how you are scoring? Please update your scores. I am waiting so that we can go for the next question. Update your scores. Yeah, 1/2 or 2/2 or 0/2, whatever. Update your scores. Yeah, there are points coming out. Very good. Come on, come on. Huh? I'm waiting. I'm waiting. This is how I'll know that you are performing. Nah? Yeah, update your scores, please. Next 33rd question. Go through this question, please. Dr. Everall feels. Dr. Everall feels. Yeah. Any new student? No, all are regular students. Yes. Right. So, Dr. Everall feels that, feeling. So, what is the feeling? Okay. What Dr. Previous question also feels. Feels. See this. This is very important. Note down. This word is very crucial. Feels. Means what is his opinion? Here also feels. Okay. This is the latest question paper. Right. Dr. Everall feels that some patients are reluctant. Some patients are reluctant to engage with the dangers of cholesterol because reluctant means not interested. Very special word. C2 vocabulary. If you learn these words, it will be helpful in your writing and speaking and reading and listening. If you don't know the meaning of this word, it will be very difficult. Reluctant is C2 vocabulary. Engage is also a very important word. Dr. Everall feels that some patients are reluctant to engage with the dangers of cholesterol because cause and effect relationship. Cause and effect, whatever I'm telling you, even the first question you can see. Okay. I'll tell you every now and then I'll tell you these are very, very important. See here, arise due to. Due to means because. Due to means because. You should understand the reason behind this question. What exactly is asking you? Dr. Everall thinks, feels, considers, opines. So this is also a similar question. Thinks. Due to. Due to means because of. Because means cause and effect. Now, right. So Dr. Everall feels that using the words good and bad to describe types of cholesterol. Okay. Why do we use? Why? Why means because. This is also because. Cause and effect relationship. Cause and effect relationship. Cause and effect relationship. Why does Dr. Everall feel that? Okay. It is why. Okay. Does Dr. Everall feel that it is okay to use the words good and bad to describe the types of cholesterol? Why? Because they may be a useful way of clarifying. They may be because they may be because they may be useful. So the questions are in the same patterns. Understand how the pattern is unfolding. So this is also cause and effect relationship. So what is the reason for this? Why does he feel that patients are reluctant? Why? What is the reason? According to him, according to this Dr. Everall, okay, what is the reason why some patients are reluctant to engage with dangers of cholesterol? So he's asking for the reason. Because means he's asking for the reason. The previous question also is the same thing, and the previous question also is the same thing. Because means due to. Okay, why? Yeah. Now, the standard investigations aren't generally available to them. So this is because of the non-availability, inaccessible. Write down these synonyms when I'm telling you, because they are very, very important. Not available, unavailable, okay, inaccessible, inaccessible, inaccessible. Actually, because my students, they are not very regular. Otherwise, I can do miracles for them, but they are not regular. They have more important works to do. They have to work, they have to earn their salary, they have to look after their family, they have to look after many things. They have to do cooking, they have to do that, they have to do this. Because of all these things, they don't have time. They don't have time. Everyone in the world has 24 hours, but these people don't have time in the world. They said, no time, sir. Huh? They say, no time, sir. Everyone else has 24 hours, but these people have no time. The word is no time, sir. Huh? So what can I do? I really need some serious students. Really, I'm telling you. Yeah. Dr. Everall feels that some patients are reluctant to engage. So, because non-accessible, not accessible, not available, okay, and not reachable. Okay, standard investigations are not reachable. Investigation means research. Standard investigations aren't generally available to them. So, lack of availability of investigations, okay, to the patients. They don't realize which social groups are most likely to be affected. They realize, okay, they do not realize. Who do not realize? The patients. The patients do not realize. They don't realize, means lack of realization, lack of availability, lack of realization. That means awareness. This is inaccessible. Okay, try to understand how it is talking there. This is access. First one is access. Okay. Second one is awareness. See, I'm giving one word for this one. Awareness. And the next one is so significance, or what do you call it, as science. Lack of science. First one is lack of accessibility. How do I make this one small? Oh, okay. Lack of access. Okay. I'm giving you three words here. A is access. Access is not there. Next one is B, awareness is not there. And C, signs and symptoms are not there. How do we know this one? This is negative, this is negative, negative. Everything is there very clearly presented. Okay. Not. See here, this is not. So into, not there. Access is not there. Don't means not. Means awareness is not there. Okay. Realization means awareness. Awareness is not there. They don't know. Lack of knowledge, lack of awareness. Okay. No. Symptoms. So means signs are not there. Lack of signs. Lack of symptoms. No noticeable symptoms are associated with this gradual accumulation. See there. All the three things are not there. So first one is negative. Second one is negative. Third one is negative. All the three are negative reasons. So investigations are not there. That means there is no research. And people don't come to them and do research. Number two, they themselves don't realize, okay, they don't know that they have the problem. So which social groups they are affected? Which social group? That means a high income group, low income group, or which social group, what work they do based on all these things. Okay. Social group, they live in the rich place, or they live in the city, or they live in the slums, or social group. What social group? Backwards class, or middle class, or high level class, upper class. So which social? So is this big now? So all the three are not there. So access or awareness or science. What is the reason? It's not accessible. That's why they don't. They're reluctant. Okay. Awareness is not there. So they are reluctant. Signs are not there. So they are reluctant. See, for this question, what do you think? For this question, there is no need to listen to the audio also. Listening to the audio is a nonsense for this. Listening to the audio is unnecessary. We can get the answer here itself. Okay. We can get the answer here itself. Very clearly, it is very clear. Very, very clear. Without the audio, you can do this answer. I'm 100% sure. Okay. I don't know whether you agree or not. That's not my problem. But I'll show you after you do this audio. Listen to this audio and you answer. Yeah. I will show you. I'll prove you that audio is not required for this. That is what is called wisdom. Apply your wisdom and you'll get everything there. Question 33. Yeah.
And whilst genetic factors are sometimes in play, different types of cholesterol particles, and helps us identify patients needing treatment. But patients can be reluctant to engage with the issue of cholesterol. As we know, when it comes to treatment, early intervention is key, but patients don't always see this. One thing they find hard to grasp is that although they feel perfectly fit and healthy, high cholesterol can be building up inside blood vessel walls, narrowing them and reducing blood flow to the heart and brain, thereby increasing the risk of cardiovascular problems. That's why it's imperative for those in high-risk groups, essentially men over 45 and women over 55, to have regular blood tests to measure not just the total amount of cholesterol in the blood, but also levels of HDL, LDL and triglycerides, a fatty substance similar to bad cholesterol. And preventive medicine has a key role to play here. It's estimated that 60% of adults in high-risk age groups have raised cholesterol levels. And whilst genetic factors are sometimes in play, in most cases it's just the result of poor diet, obesity and lack of exercise, often reflecting the habits of a life.
Okay. Now let us see here. You can submit your answer. Question 33. Question number 33. Yeah, submit your answer, ABC. Submit your answer, ABC. This test is given especially for the exam going students. These tricks are meant for the exam going students. Okay. Yeah. A, B, C. Logical reasoning approach. Yes. Logical reasoning approach. Now I am going to prove you why this is right. Yeah, update your scores, please. Update scores, please. Update scores, please. Give them 2 by 2 or 3 by 3 or 1 by 1 or 0 by 3, whatever. Update your scores. Copy, post link. You can check your answer there. Yeah. You can check your answer there. So welcome to the platform, Vani Gowda. Welcome to the platform. Any new students are there? Welcome to the platform. This is a very special platform where you will get all the things clarifications. And if you want regular sessions, you can contact us. Okay. So Vani Gowda. Yeah. Yeah, this is for the link to connect me. Okay. So, right. Now let me explain you. Let me explain you here. The standard investigations are generally available, not available to them. So very clearly, this is a self-defeating option. Actually, there is no need to think about this. Why? This is definitely not the option. Without listening to the audio, I can definitely tell that this is definitely not the option. Why? Because if the standard investigations are available to them, then they will tell that they have this type of problem. They will tell that there are dangers. Okay. If the standard investigations are available to them, they will get the test results and they have the proof of everything. Okay. So when they are put in front of them, they will just believe it. They will not be reluctant. Okay. Some patients are reluctant to engage with the dangers of cholesterol because the standard investigations aren't generally available to them. If they are generally available, they will be put forward to them and they will have no other option, but they will accept. How can they be reluctant when they know everything? So standard investigations are the real proofs. That is a witness, the evidence. How can they say no when there is an evidence? How can they be reluctant when there is an evidence? Are they mad? Are they crazy? Are they foolish? No. So standard investigations means evidence. If evidence is generally available to them, they will accept. So if they are not available to them, then how can they accept? So that is the point. So that means they do not know anything about them. Then how can they be accept? First of all, how can you tell that they have this problem? So if you tell, they will definitely accept there. So by default, this is a wrong option. Second one, they don't realize which social groups are most likely to be affected. If they don't realize, how they will realize? How will they realize? Okay. Somebody should create an awareness, na? How can they realize? How do I know that this fat is wrong for me? How do I know? Somebody should create an awareness. So if they create an awareness, if they tell them, they will not be reluctant, right? Okay. If somebody creates awareness, they will know. Yeah, somebody is telling so. 1% told, 2% told, third person, at least third person, somebody will listen to them. They don't realize which social groups are most likely to be affected. How will they realize? If they don't realize, then how can you say they are reluctant? If they realize, and still they are reluctant, you can say they are reluctant. But they don't even realize. How can they be reluctant? They don't even know. How can they be reluctant? So it is a self-defeating question there. And they don't, the information is not available to them. If the information is available to them, it's the first one. If the information is available to them, then they will accept. No? The information is only not put forward to them. The investigations are not available to them. So how can you say they are reluctant? You cannot say they are reluctant, right? Because the information, the investigations are not available to them. If they are available to them, then they can say yes or no. First of all, information is only not there. Then how can you say yes or no? They don't have an idea about it. They will dream about it or what? So be careful here. No noticeable symptoms are associated with its gradual, like slowly, it's adding upon day by day. And the symptoms are not available there. So they are not able to notice that one. So because of that, maybe. So first one is ruled out by default. Second one is ruled out by default. Third one, yeah, it cannot be noticed. The symptoms cannot be noticed by them. That's okay. Investigations who should do? Researchers should do. That is their problem. So the problem is regarding the researchers, the investigators, the specialists. It is their mistake. So how can you attribute that patients are reluctant? Second one, in the social groups, there is some problem. They are affected. How can these people know that this particular group is affected? If somebody should tell, they know. So that means the health personnel should tell them. It is their mistake, not these people. These are innocent human beings. Okay, research should be done. The health worker should tell them. Then only they can notice, because of, so no symptoms are also there. So that is why they are not able to identify. That's why they are reluctant to. So they, you say I have fat. How can you say I have fat? There may be fat inside, but how can you say there is fat? Because I cannot see any difference. I cannot see any difference. So how can I accept? So there are no symptoms. That's why they are reluctant. That's logical. So by default, you can understand very clearly. Okay. So what's going on? Okay. Oh, yeah. So by default, this is also gone. Yeah. Symptoms not present, and therefore you cannot notice. Symptoms are not present, and therefore you cannot notice. Even without seeing, you can give this answer. When I tell you, I mean it. Okay. Do you understand the logic here? Do you understand the logic here? Was the explanation beneficial? Was the explanation useful? Yeah. Come on, let's move on to the next question. Yeah, this is 34th question. 34th question. Thank you for the people who are responding with your answers. Yeah, 34th question. 3 more questions are there. Afterwards, we'll see something else. Study the question. In terms of preventive medicine, so you should know where it is changing. First of all, now I'm going to, when only one person is talking, how the topic is shifted from one question to another question. That I am going to show you now. So now let me show you here. This is talking about misunderstandings. This is talking about good and bad cholesterol. And this is talking about reluctance. How topic is changing, you should know. And this is talking about preventive medicine. And this is talking about a drug called inclirsan. And this is about gene silencing. So there will be one particular word which will tell that you have to move on. What the earlier question is finished, you have to move on to the next question. Now let us see here. This is talking about misunderstandings. This is talking about good and bad. Okay. Let me tell you how to identify this one also is very key. Okay. Right. Yeah, now let me show you here how to identify this one. Now, there are some words, okay, which are not very important. Let us take the color. Yeah. Common color, that is green. Yeah, green means not important. Dr. Everall. Dr. Everall. I'm showing you the techniques. Which is the best word to identify? Dr. Everall. Dr. Everall. Dr. Everall. So forget about Dr. Everall. You need not think about it because it is common everywhere. It is common everywhere. It's common everywhere. So forget about that. Next one. Cholesterol. 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 Okay, next one. Now here, if you see, the most important, the worst aspect, the worst aspect, the worst aspect. What do you mean by the worst aspect here? The first thing is, when I tell you, remember one thing what I'm going to tell you now. The worst aspect is many students lose their marks because they don't even know that the question is already passing by. And they're still reclining in the previous question. They don't even know that you are still in the 32nd question. And already he's talking about the information which is relevant to the 33rd question. This is the biggest drawback. That means you lost 30-second answer already, and you're already losing at the verge of losing the 33rd answer. So try to understand here very clear. This is called madness actually. Because lack of awareness of when the question is moving to the next question. So when should you remove your leg and put it on the next step? When you are climbing the ladder, first step, second step. So 31st, 32nd, 33rd, 34th. Now, what you are doing here, you have the 33rd step already came, but you are not removing your leg and putting it on the 33rd step. You are still in the 32nd step. There are many people, when the escalator comes, they don't know how to climb onto the escalator, and they want to put their leg and move back, put and move back, put and move. So like that, that's a confusion, chaos. They don't realize that the escalator is moving. They cannot decide when they have to put the leg on it because they're scared, they're afraid. So in the same way, our students who are doing this test, they don't know that the question has already gone. Now, you will not get the next question, this particular question, 30-second, because it's already gone. Practically speaking, you have already lost the 30-second question answer. And the information which is going on, played on the audio, is relevant to the 33rd question, and you are still stuck to the 32nd question. The devil is that you don't even realize that you already lost one question. And the bigger devil is you are going to lose another question. That's the danger. So you're losing 2 marks there. Because when the answer came, you lost it. And the answer for the next question is coming, and still you are losing that one also. So that's it. Okay. You're in the wrong place for the right answer and right place for the wrong answer. So both you are losing. So be careful, very careful. First, you should know when to select to skip the question and move further. That is what I'm telling you now. That's what many people don't even realize this. And then they just think Simon sir is wasting our time. Yeah, I don't mind. Okay. So now next one. What are the other words? Things, not important. Things, not important. Feels, not important. Feels, not important. Okay. Suggests, not important. One word will definitely be say. Overall, say, not important. Daughter make. Make means a say, not important. Finished. Next word is about. This word also is common word. See there. About. Not important. Okay. Not important. Next one. About. Not important. The words which are repeatedly coming are not important. Remember that. Not important. Okay. Now, next one. The. Not important. That. Not important. The. Not important. And. Not important. To. Not important. Of. Not important. Remove the small words. That. Not important. Are. Not important. To. Not important. With. Not important. The. Not important. Of. Not important. So I'm just giving you an idea. If you can catch, I told you this is exam going student special. Okay. Right. Next one. Next one. Of, not important. In, not important. That, not important. Of, not important. May, not important. From, not important. Finished. Leave it. Next. The, not important. Called, not important. Does, not important. The, not important. As, not important. Finished. Now, we are left with only 50% of the words. 50% of the words. Now, in this, what is the most important word? Now, I am going to select that one. Okay. The dangerous word or the deadly word. You should know. Right. The biggest word is more important. Misunderstandings. Okay, let us take yellow or blue. Yeah, let us take blue. That is very important. Misunderstandings. Role of, largely, arise, due. All these are small words. So biggest word you take. That's more important. Next one. Next one is descriptive words. Descriptive words. Descriptive words. What are descriptive words? Good and bad. Good and bad. This is good. This is bad. So contradictory words. Contradictory words. Good and bad. Excellent, worst. Like this. Okay. Next one. And the second thing, you can say the words which are in the inverted commas are very, very important. The words in the inverted commas are very, very important. Inverted commas, you can see here, this is inverted comma. Okay. This is inverted comma. This is inverted comma. The words in the inverted commas are very, very important. He is indirectly telling you that these words are very important. Good and bad. So for example, your parents say, he is good, he is bad. That means don't be like him, be like him. Okay. Don't make friendship with everyone. Mr. X is very bad. Be careful. That means don't make friends with him. So we are clarifying the concept of what is good and what is bad. You're giving a clear picture of that one. Okay, differentiating between good and bad is very, very important. The criteria is what is good and what is bad. So this is based on what is good. Positive character. Based on positive character, this is good. That means this is not good. This is bad. Good and not good. Good and not good. Not good means bad. So try to understand that one. It's a descriptor. Very, very important. And here you can see they are put in inverted commas. Next one. Next one. Here the most important word is reluctant. The level of the word, you should know the power of the word reluctant. A special vocabulary, reluctant. Now I am taking you to Cambridge Dictionary. Reluctant is a very special word. If you think that the word is very difficult for you, that means it is very important for you. Okay, it's very, very important for you, because not everyone will know the meaning of this word. Reluctant. Reluctant is C1 vocabulary. Reluctant is a C1 vocabulary, and reluctance is here you can say reluctance. Okay, C1 and C2 vocabulary, they are right. Reluctance, reluctant. Okay, reluctantly C1. So reluctance, reluctant, reluctantly, all are C1 vocabulary. You can see it very easily. C1 vocabulary. That means if you know this word, that means you will pass the exam. C1, okay, will get B grade. C2 will get A grade in the exam. So if you cannot answer this question, that means it is very difficult to pass the exam, because many questions are like this. Many questions are like this. Those who cannot answer these questions, which are testing C2 vocabulary, they cannot pass the exam. Those who cannot answer the questions C2 vocabulary, they can pass the exam, but they cannot get A grade. That's the point here. Okay, remember that. So here, reluctant is most important. Reluctant. Why are they reluctant? Because the investigations are not available, they don't realize, and there are no symptoms. If you see, I don't have any symptoms, so why should I? That's why they're reluctant to participate in with the dangers of cholesterol. They don't want to participate actively because they don't see any symptoms. They will make, hey, you're telling nonsense. I don't have any symptoms. See, where is fat? Where is fat? Fat is inside the body. It may not be visible always. Okay, right. Next, no noticeable symptoms are associated with this gradual acclimation. Slowly, 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 they are. So only you will know when it is very clear, but it's difficult. Next one here, preventive medicine. Preventive medicine, special word. Okay, next one here, preventive medicine. And here there is a drug. Drug is common word, but inclisiran is a specific. Yeah, drug is a generic. Commonly any drug is a drug, but inclisiran is a specific drug for cholesterol. Okay, next. Now here, technology. Technology. What is this technology? Technology is common, but what technology known as? This technology is known as a particular technology which is known as gene silencing. Technology known as gene silencing. Technology is common. Technology is a big word, but technology is common. This technology is known as gene silencing. So gene silencing is equal to technology. Technology is equal to gene silencing here. But means all technology is not gene silencing, but this particular technology is gene silencing. You understand? A particular technology called gene silencing. So gene silencing is more important than technology, because technology is generic technology, but gene silencing is a specific technology. So this is how you will jump into the next question. See, many people don't have patience to wait and listen also. They just want to rush. It's okay, no problem. We don't mind. Okay. I have gone into the depth of the point to identify when the question is jumping to the next question. People are not ready to wait. So that is their problem. Right. In terms of preventive medicine, Dr. Everall mentions research that suggests high levels of cholesterol may result from, or because of, or result from means because of cause and effect theory. Cause and effect theory. Preventive medicine. Okay. Result from. Preventive medicine suggests that high levels of cholesterol may result from, okay, the existence of inherent predisposition. The existence of means presence, availability of an inherent predisposition. Inherent predisposition. Inherent, remember that. Lifestyle factors. Lifestyle factors. Lifestyle factors. So second one is lifestyle factors that aren't usually associated with it, with cholesterol. Lifestyle factors. A range of modifiable behaviors particular to one age group. A range of modifiable behaviors, modify, which can be transformed, modifications, altered, a range of, because of, result from a range of modifiable behaviors particular to one age group. So is it inherited disposition? This is genetics. This is genetics. Inherited means genetics. So you should know the synonyms of the words. This is talking about genetics because they came from the parents. Okay. A is genetics. A is genetics. And this is lifestyle factors. Lifestyle factors. Lifestyle factors. What is lifestyle factors? So how your, your habits are. What are your habits? These habits are because of your environment. Lifestyle factors, how you are behaving, how you are eating, what you are. This is environment. Environment. If you are in the UK, you eat burgers. If you are in India, you eat chapatis. If you are in China, you eat noodles. This is environment. Genetics are different from environment. Lifestyle factors. Okay, lifestyle factors. Then third one is a range of modifiable behaviors. Modified genetics to environment. This is in between. This is mutual or interdependent. Interdependent or interconversion. Interrelated, you can say. Interrelated from genetics to environment, both together. So range of modifiable behaviors particular to one age group. Right. Now, if you consider these three things, it is related to genetics, environment, and genetics and environment clash. First one is only related to genetics. Second one is only related to environment. Third one is between the mutual, okay, interaction between genetics and environment, means both together play a role. So that's what it. So try to understand this point very clearly. You cannot notice that very easily. Okay, you cannot understand that. You cannot understand that very easily. So genetics, inheritance. Inheritance means genetics coming from father to children. That's very. So lifestyle factors is not like that. Lifestyle factors is because of the society. Okay. Genetics are by birth. You're fat or you're thin, you're tall or you're short. Tallness, shortness, fat, fatness or thinness. All these are genetics. Okay. But environment, father is thin, but still son is fat. Why? Because of overeating. Okay. Overeating, junk food, all these things. Lifestyle factors. Okay. And third one is clubbing of both these things. Now let us go to the question. So those who understand this in this style, you will never miss the question. Okay.
Different types of cholesterol particles and helps us identify patients needing treatment. But patients can be reluctant to engage with the issue of cholesterol. As we know, when it comes to treatment, early intervention is key, but patients don't always see this. One thing they find hard to grasp is that although they feel perfectly fit and healthy, high cholesterol can be building up inside blood vessel walls, narrowing them and reducing blood flow to the heart and brain, thereby increasing the risk of cardiovascular problems. That's why it's imperative for those in high-risk groups, essentially men over 45 and women over 55, to have regular blood tests to measure not just the total amount of cholesterol in the blood, but also levels of HDL, LDL and triglycerides, a fatty substance similar to bad cholesterol. And preventive medicine has a key role to play here. It's estimated that 60% of adults in high-risk age groups have raised cholesterol levels. And whilst genetic factors are sometimes in play, in most cases it's just the result of poor diet, obesity and lack of exercise, often reflecting the habits of a lifetime. So it's clear that we should be talking to younger patients about these issues too, and not just about diet and exercise either. There's research to suggest a link between stressful situations and how the body metabolizes fat. And that's in addition to the fact that stressed out people are more likely to smoke or have poor diets. So we should be underlining the need for a good work-life balance, for taking regular breaks and managing stress levels in the workplace long before patients enter the high-risk demographic. Traditionally, statins have been the most commonly prescribed medication for high cholesterol, and that generally means a daily dose taken orally for life. Statins lower LDL levels by slowing down the production of cholesterol in the liver. But a new drug called inclisiran works in a different way, targeting a gene that produces the protein.
New drug, inclisiran. So you understand that very clearly now. Right. Now give your answer. So question 34. Yeah, submit your answer, please. Question 34. Yeah. Only 3 have answered. Okay. CACC. Very good. Excellent. Excellent. Wonderful. Not even one person has written the right answer. Good. That means you can understand. Okay. That this question is a very difficult question. This question is a very difficult question. Here, I explained to you so much. I explained you so much. He said this is just not because of not um, I'll show you the script. That is better. That will be easier for me. Without seeing, it will be a little difficult for you to understand. I'll show it to you. So the answer is wrong. So I'm going to explain you. People don't wait to see. That is why, in spite of my explanation, you lost the mark. So you can understand that the in-depth intensity of the questions, the seriousness of the question. 34. A, B, C. $34. Yeah, here is the option. Yeah, you can check and you can update your scores. You can check and you can update scores, please. Now I'm going to show you. Yeah. Mm-hmm. Yeah. Yes. I'm going to show you now. So this is 33rd question. Patients can be reluctant to engage with the issue of cholesterol, as we know, when it comes to treatment. When it comes to treatment. Okay. Patients can be reluctant to engage with the issue of cholesterol, as we know, when it comes to treatment. Early intervention is key, but patients don't always see this. One thing they find hard to grasp is that although they feel perfectly fit and healthy, high cholesterol can be building up inside blood vessels, narrowing them, reducing blood flow to the heart and brain, thereby increasing. That's why it's imperative for those in high risk groups, especially men over 45 and women over 55, to have. So, preventive medicine here. And preventive medicine has a key role to play here. It's estimated that 60% of adults in high risk age groups have raised cholesterol levels, and whereas genetic factors are sometimes genetic factors. Genetic factors. What do you mean by genetic factors? I already told you. Okay, inherited. That is genetic factors. Inherited genetic factors are sometimes in play. In most cases, it's just the result of poor diet, obesity, and lack of exercise. See here, it's not genetic factors. Genetic factors are sometimes in play, sometimes only, but in most cases, it's not genetic factors. That's the point. While genetic factors are sometimes in play, that means very minimum. In most cases, that means in least cases, in most cases. In majority of cases, it's just the result of poor diet, obesity, and lack of exercise. It is poor diet, number one, obesity, number two, lack of exercise, number three. These are the reason in most cases. That means most cases means above 50%. Or even 80%, we can say. Most, majority means 80%. And 20%, some places, some cases, genetic. Some cases means 20% it is genetics coming from parents. Obesity is coming from parents, genetic factors, inherited factors, 20%. But most cases, 80%, it is just the result of poor diet, obesity, and lack of exercise. Often reflecting the habits of a lifetime. Habits, styles, lifestyles. Habits means style of life. Drinks, smokes, eats from fast food restaurants. These are habits. Smoking is a habit. Drinking is a habit. Eating from fast food restaurants is a habit. So lifetime habits are nothing but lifestyles. Okay? Lifestyles. Don't you understand that? Don't you understand that? And diet is a habit. It's a lifestyle. Diet is not heredity. Diet is what you eat all your life. Exercise is what you do every day. Okay? And not just about diet and exercise either. There are many other things. Stressful situation, work. Stressful situation, stress, everyday stress. There are some people, I'm tensed, I'm upset, I'm worried, I'm tensed. Yesterday, one of my students, he was asking me, okay, you take medicines once in a lifetime. Taking medication is not my lifestyle. Taking medications is not my lifestyle because I'll take once in a lifetime. Maybe if some serious problems come, then I take medication. And even when people give me medication, I many times avoid that. I'll wait for a day or two. And if it is serious, then I'll take medication. Otherwise, I'll not. I'll not. Yeah. So, stress. Some people get headache. Oh, I'm getting headache. They'll do that. They'll do this. Then what I will do, I'll just go, put on my bed and sleep. Finished. If I get headache, I just lie down. That's it. And I go to sleep. I forget about everything. I watch one comedy and I just sleep. I forget everything. Or second option is I see a small child singing a song or dancing. Children videos because they are innocent. I forget all my problems in that one small comedy movie video, 5 minutes or 3 minutes. I forget. And most effective medicine for headache is watching a small child dance. That is for me. For you, I don't know. So, stress. Why should I take stress? Stress, taking stress and beating my head is not my lifestyle. Okay. Whenever there is a stress, I relax. That's it. This headache is an indication that your mind needs rest. And still you beat it heavily, and intensity will only increase, multiply. Right. So forget that. Many people say, how can you forget? Yeah, I have a technique. That's it. I have already told you. So now next one, stressed out people are more often likely to smoke or have food. If somebody is stressed, they want to have a smoke. They want to go and have some drink. They want to eat more. Okay. Improper diet. They don't eat properly or they eat more. They don't want to cook. They'll eat fast food. They'll go and smoke. They'll go and drink. They'll go and fight with others. So that's it. So here, work-life balance, lifestyle. Regular breaks, lifestyle. I take one lecture and I'll take a break. I'll take one correction and I'll take a break. Every time I take break because I need it. This is called managing stress levels at the workplace. Lifestyle, work style is a lifestyle. Okay, that's it. Remember that. Everywhere is telling that it's life, 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 lifestyle. Why don't we understand that? Okay. So the answer is, yeah, lifestyle factors which are not actually associated with cholesterol. Too much stress. So you overeat or you undereat. Both are problematic. You want to relieve the stress, then you'll go somewhere and you say, I'll cup of tea or something. Then you'll have a smoke or you'll go and drink and you want to forget it. So that's the problem. Lifestyle, how you deal with these things is very important. This stress is not related to your cholesterol. Try to understand that. This stress is not related to your cholesterol. This panic is not related to this cholesterol, but these are resulting in cholesterol indirectly. Let us see the question there. Yeah. The lifestyle factors that aren't usually associated with the cholesterol. Stress. What is it associated with cholesterol? Lifestyle factor is stress. Heavily stressful workplace environment. Oh, I also have stressful work. For example, my staff, sometimes don't work properly. Okay, my staff, they don't come in time. My staff want to go early. My staff want to do something else doing work. They're talking during office time. Some staff, they are going out for tea and coming after 1 hour. So if in my place somebody else is there, they will take stress. Why are they doing like this? Why are they doing like this? How can they do that? The institution is paying for this one. They are wasting the institution's time. They're on the phone for 1 hour, half hour. With whom they are talking? They'll take stress. But I will not take stress. I already gave them 3 months time, or 2 months time, or 1 month's time. I give them time. I'll see 1 month. If it is okay, then 2 months. If it is okay, then 3 months. Maximum 3 months. After that, they will not work with me. So the time, patience is there. Okay. Why should I get stressed for them? If I take stress, then I'll fight with them. And I'll become enemy for them. Okay. Why all these things for me? So relax. I'll tell somebody there, sir, for example, my coordinator is there. Coordinator, he will tell. There are 3 or 4 coordinators. They'll tell, sir, this person is not working. Said, okay, forget it. I'll take care. They will get burnt up, but I will be cool. Okay. After 1 month, they will go off. They're going to lose their job. So why should we bother for them? If they're serious, they will stay. If they're staying, then we'll bother. So it's test of time. So relax. Now, next thing is lifestyle factors that aren't usual. So many people say, sir, why are you so healthy? How are you so healthy? My wife tells me, oh, you are very healthy. See, I am very much suffering. I take medicine. I take that one. Oh, all different types of medicine she has. For everything, there's a medicine for her. For BP, for everything, she has certain type of headache medicine, aches medicine, all different types of medicine will be there in the house. Okay. She tells me, you have very good health. How is that? You don't even get headache. How is that? So what is it my problem? For example, I'll tell you the reason. This is lifestyle. There's no worry. Lifestyle. Why are you not fat? Why I am becoming fat? Yeah, this is also one reason. There is a fight between husbands and wife. For example, with me and my wife. Why are you so thin? Why are you not fat? Huh? So the point is there. Try to understand here very clearly. The maid did not come. I'll say, okay, leave it. No, why is she not coming? She'll call. 4, 5 times she'll call. She'll not pick. She'll say, you are not bothered. Her headache, she wants to transfer to me. I'll say, okay. What's the problem? She did not come. You're not bothered. Why don't you call her and tell her? Tell her serious. I say, okay. That is a headache, but this is even bigger headache for me now. What I'll do? I'll put on my slippers and I'll go out. I'll come after 2 hours. Finished. My problem is solved. Why should I get headache? She'll be calling. She will increase her headache, but I will be very cool. Then when I go home, again they will say something. Then again I'll take my slippers and I'll be ready. No, 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 I'll not ask anything. Okay, then let me do my work. Finished. What I can do, what she can do, what anybody can do. The next day she will come and say, I had an operation. My son had an operation. I'm just telling you, lifestyle factor which worry you. Okay. Stress, if you take it, it will kill you. Right? So be very clear. Right. So don't take these things because these will indirectly influence your body. So lifestyle factors that aren't usually associated with it. Right. Yeah. 1 week back, my wife was asking, maybe I'll get paralysis. Why? I'm getting tension. I'm getting panic. I'll get paralysis. So another question. So like this, many things rise because of your lifestyle. You get early up in the morning, no need to take tension. I'll get up, directly I'll go into washroom, clear everything, take bath, come out, dress up, and then sit. Finished. Everything will go on systematically from morning till evening. Right. So lifestyle is very important. Lifestyle factors are very important. So you have to, in terms of preventive medicine, bother about these things more than anything else. Prevent all these problems. So your scores 3 by 4, 2 by 4, 4 by 4. All of you have given wrong answer. All of you. There's a difficulty here. Now let us see here. Stressed out people are more likely to smoke. And smoking is one habit. It's a lifestyle again. It's a lifestyle. Smoking. Once he starts smoking, he goes on smoking. Right? Because of this, there are some negative things. Then poor diet. He may eat less or he may eat more. Because of that, another lifestyle problem. Overeating or undereating. Lack of nourishing food. Nutritious food. Nourishment. Proper nourishment. Improper nourishment. So all these are lifestyle habits. That's very clear. You have to see here. Life is balanced. Means balanced lifestyle. Life is balanced. Work-life balance. Balanced lifestyle. There is no balance, imbalanced lifestyle. So everything is lifestyle factors which are not related to cholesterol. Everything is there. Smoking is not related to cholesterol. Eating is not related. Poor diet is not related to cholesterol. Stress is not related to cholesterol. Too much work is not related to cholesterol. All these things not related to, but still that's a problem. Next. Difficult question. Yes, it's really a difficult question. 34th question. Next, 35th question. Here it is. As you go, the intensity increases in the question. Okay. Yeah. Go through this question. What does Dr. Everall say about the drug called inclisiran? Only one word is important. That is inclisiran. Okay. Inclisiran. Inclisiran is a drug. What does Dr. Everall say? Its use could lead to considerable cost savings. So savings means economical. Its use could lead to considerable cost savings. This drug is benefiting by economic aspects, saving the money, cost saving. Patients are likely to tolerate it better Then existing options. So tolerance level is excellent. Patients can tolerate. Okay. Patients can tolerate this. So tolerance. First one is finance, financial benefit. Second one is tolerance level. Third one is further research is needed to establish its full range of possible uses. Further research. So research, more research is needed. First one is financial aspect. Second one is tolerance aspect. Tolerance. Patients can tolerate it. Patients are likely to tolerate it. Tolerance. No, I don't want it. It is very painful. No, patients can tolerate this one. This drug. Tolerance capacity, capability, or ability. Tolerance level will be better than the existing options. So first one is cost. First one is cost. Second one is patient tolerance. Financial savings. First one, finance. Financial benefit. Second one is tolerance. Better tolerance. Third one is more research is needed. Research is not sufficient. You have to establish, means confirm. If we use inclisiran, money is saved. Money is saved. Financial gain. Yeah, sorry for the interruption. There was some network issue. Yes, I have connected it with my mobile. Yeah. So, tolerance. So drug called inclisiran. What is the benefit of this one? What does he say? Its use could lead to considerable cost saving. Saving means financial benefit. Patients are likely to tolerate it better than existing options. So tolerate, tolerate. Okay. So ability to tolerate. Further research. So research is needed more to establish its full range of possible uses. So focusing on research. So he's talking about savings, financial benefits, or is it talking about tolerating capacity of the patient, or is it talking about more research which is needed? So those you have to focus. These are the three things you have to focus. Yeah, it will be a little difficult one. So, oh,
To measure not just the total amount of cholesterol in the blood, but also levels of HDL, LDL, and triglycerides, a fatty substance similar to bad cholesterol. And preventive medicine has a key role to play here. It's estimated that 60% of adults in high-risk age groups have raised cholesterol levels. And whilst genetic factors are sometimes in play, in most cases it's just the result of poor diet, obesity, and lack of exercise, often reflecting the habits of a lifetime. So it's clear that we should be talking to younger patients about these issues too, and not just about diet and exercise either. There's research to suggest a link between stressful situations and how the body metabolizes fat. And that's in addition to the fact that stressed out people are more likely to smoke or have poor diets. So we should be underlining the need for a good work-life balance, for taking regular breaks and managing stress levels in the workplace long before patients enter the high-risk demographic. Traditionally, statins have been the most commonly prescribed medication for high cholesterol, and that generally means a daily dose taken orally for life. Statins lower LDL levels by slowing down the production of cholesterol in the liver. But a new drug called inclisiran works in a different way, targeting a gene that produces the protein PCSK9 to encourage the liver to absorb more bad cholesterol from the blood and break it down. As well as only requiring twice-yearly injections, making it much more convenient, the drug has fewer side effects, which, with statins, can include headaches and digestive problems. And studies show that treatment can reduce cholesterol by up to 50% in as little as 2 weeks. The drug's an example of what's called gene silencing. This is a unique mechanism that aims to disrupt the delivery of messages sent out by a gene that can
yeah. So now we have the next question. Question 35. So from now onwards, apply these techniques for every question and it will be easy for you. Now question 35. 35. Yeah, submit your answer, please. What do you think your answer is? Yeah, come on, come on, come on. Yeah, only 2 students. Come on. Yes. Okay. So let us check the answer now. Question number 35. A, B, C. 35. Logical reasoning approach. Yes. So this is the post link. This is the post link. Yes. Submit your answer, please. And I'll take you to the question. Yeah. Yes. Traditionally, statins have been the most commonly prescribed medication for high cholesterol, and that generally means a daily dose. Every day they should take. Taken orally for lifetime, very long time. Statins lower LDL levels by slowing down the production of cholesterol in the liver. But a new drug called inclisiran, here it is, works in a different way, targeting a gene that produces the protein PCSK9 to encourage the liver to absorb more bad cholesterol from the blood and break it down, as well as only requiring twice yearly injections. Twice yearly injections. Okay. Statins, they're taken every day. But this inclisiran, twice yearly, once in 6 months, you have to take, making it much more convenient. But he's not telling anything about financial thing. Nah? He's telling about anything about money. Cost effective. Is he telling anything about cost effective? He's telling convenient. Just to take 2 times and relax. Convenient. But here these statins, you have to take every day, daily dose for lifetime, all your life. Every day you have to take. Okay. A daily dose taken orally for lifetime. Okay. Now here, inclisiran, the difference between statin and inclisiran. Now here, this is taken only twice yearly. It requires only twice yearly injections. That is also injections. No need to take oral. It's injections, twice yearly injections. So, making it much more convenient, comfortable. Okay, comfortable. That means they can easily take 2 injections. Rather than they cannot tolerate taking every day statins orally all their lifetime, every day. But taking twice yearly injections is enough, making it much more convenient. And this drug has fewer side effects. Side effects are also less. With which with statins can include headaches and digestive problems. Statins have problem. They have to bear all these things. If they have to tolerate statins, they have to take headaches. So if they take statins, they get headaches. They get digestive problems. Okay. So they get headaches and they get digestive problems with the statins, and they have to take every day. But the headaches and the digestive problems are not there if you take inclisiran. So they can very happily accept this one. That means they are able to tolerate this medicine more than statins. They don't want to take every day. They'll take once in 6 months. And they don't need to take orally every day, all their lifetime. They just to take once in a 6 months period. That's enough. So tolerating this is easier for them. Okay. And this shows that studies show that treatment can reduce cholesterol by up to 15% in as little as 2 weeks. Within 2 weeks. Okay. Cholesterol will be reduced by 50%. So there are 3 benefits, triple benefit. One is they need not take every day. Second thing is they need not take orally. Third thing is they do not have headaches and digestive problems. And fourth thing is, okay, those are the three negative things. And the positive thing is cholesterol is reduced by 50%. So better, na? So twice tolerate these injections, that is enough, rather than tolerating statins every day orally. Yeah. And that too, they have to tolerate headache, they have to tolerate digestive problems, they have no other option. If they take statins, they may have headaches. If they take statins, they may have digestive problems. They have to bear with them. They cannot tolerate. Okay, every day they may have problems. So just to take twice a year, that's enough. So B is the right answer. So update scores every time I have to tell you. Okay, update scores, please. Actually, students who attend regularly all these sessions, na, they'll pass in the first attempt only. What to do? You should not be overconfident. Number one, should attend regularly. Yeah. Next. Sixth question, last question. Sorry. $36. Yeah. What does Dr. Everall make about the technology known as gene silencing? What pointer suggest? What does he suggest? What does he indicate? What does he tell? What does he inform? What does he explain? All are these. What point does Dr. Everall make about the technology called gene silencing? Bold letters. Sorry, inverted commas. Very important. That is important word. Gene silent. The question is focusing on this. Inverted commas. Remember, inverted commas are very, very important. Inverted commas. You can see that. Okay. Inverted commas are very, very important. So gene silencing. Gene silencing. Okay, what point does Dr. Avala make? Claims made about its potential uses need to be treated with caution. That means care, caution. Claims made about its potential uses need to be treated with caution. Means be careful. Don't accept it as granted. Okay. Caution means alert, means danger. Danger is there. Maybe danger may be there. Danger may be there. Gene silencing. You're silencing a particular gene. When you silence this gene, this will go to another future also maybe. This conditioned gene or silenced gene will go to the offspring maybe. Okay, there is a danger. So already you are transforming the genes. Genes are natural things. And you are forcing the gene to be silent. And this transformed gene will be sent to the offspring. Okay. So heredity, it may go there. That may have side effects there also. Maybe. Then it works in a similar way to some other similar techniques. It works in a similar way to similar technique. Okay. Its working style. Its working style. First one is he's talking about caution. That means care should be taken. Second one is he's comparing that it works in the same way to some other similar techniques. Okay, that means, so working style of this drug. Wrong assumptions may sometimes be made about it. Wrong assumptions means guesswork, may sometimes be made about it. Wrong assumptions, imaginations. First one is claims made about its potential uses need to be treated with caution. Okay, somebody is telling, okay, that you have to use it very carefully. Treatment with caution. Then it works in a similar way, working style. Okay. Third one is wrong assumptions. So listen very carefully.
Situations and how the body metabolizes fat. And that's in addition to the fact that stressed out people are more likely to smoke or have poor diets. So we should be underlining the need for a good work-life balance, for taking regular breaks and managing stress levels in the workplace long before patients enter the high-risk demographic. Traditionally, statins have been the most commonly prescribed medication for high cholesterol, and that generally means a daily dose taken orally for life. Statins lower LDL levels by slowing down the production of cholesterol in the liver. But a new drug called inclisiran works in a different way, targeting a gene that produces the protein PCSK9 to encourage the liver to absorb more bad cholesterol from the blood and break it down. As well as only requiring twice-yearly injections, making it much more convenient, the drug has fewer side effects, which, with statins, can include headaches and digestive problems. And studies show that treatment can reduce cholesterol by up to 50% in as little as 2 weeks. The drug's an example of what's called gene silencing. This is a unique mechanism that aims to disrupt the delivery of messages sent out by a gene that can cause illness, in the case of cholesterol, of the protein PCSK9. It doesn't touch the gene itself, an idea about which people do get nervous, and it bears no relation to things like gene editing, which also gets a bad press. The first such medication was a drug called Partizan that was licensed in 2019 to treat amyloidosis, and work is continuing on similar drugs that could treat things like Huntington's disease and preeclampsia. So in rolling out these injections to control cholesterol, we could be looking at the future of how all disease will be treated.
Yeah. Question number 36. Question number 36. Submit your answer. 7, 6, 5, 4, 3, 2, 1, and submit. Yeah. The last answer. Yes. So CBACA. Good. Now let us check. Yes. Now the drug's an example of what's called gene silencing. Whenever there is some inverted commas, That means it is very, very important. The word is very, very important. Remember that. Yeah. So, gene silencing. Okay. This is a unique mechanism. Unique mechanism. That means something is ruled out. Unique mechanism. That means it is different. The mechanism is different. So you understand that it's not similar. Similar means not unique. Unique means individual, not same. So B is ruled out. This is a unique mechanism. That means unparalleled. Unparalleled means there is no parallel like this one. That means this is the one and only. Nothing else is there. Unique means the sun is unique. The earth is unique. That means you don't have another earth like this. You don't have another sun like this. You don't have another moon like this. Unique. For example, if you say somebody is unique, for example, if you say Narendra Modi is unique, if you say Mamata Banerjee is unique, or Bill Clinton is unique, that means you cannot have any comparison. That means he is not similar to anybody else in the world. Unique means one and only. So this shows that B is ruled out. B is ruled out. Next. That aims to disrupt the delivery of messages sent out by a gene that can cause illness. Okay. In the case of cholesterol, of the protein PCSK9, it doesn't touch the gene itself. An idea about which people do get nervous. An idea about which people do get nervous. People get nervous. It doesn't touch the gene itself. An idea about which people do get nervous, and it bears no relation to things like gene editing, which also gets a bad press. The first such medication was a drug called Partisan that was licensed in 2019 to treat amyloidosis. And work is continuing on similar drugs that could treat things like Huntington's disease and preeclampsia. There are similar drugs to Partisan, but not similar drugs to inclisiran. Try to understand that. Similar drugs are there for Partisan, but not for inclisiran. Not for inclisiran. Okay. Yes. Not for inclisiran. The drug means the particular drug called inclisiran. The drug means inclisiran is an example of what's called gene silencing. This is a unique mechanism. There is no comparison. But here, Partisan, the first such medication was a thing like Partisan. This is another one. Okay. That was licensed in 2019 to treat, and work is continuing on similar drugs that could treat things like Huntington disease and preeclampsia. So in rolling out these injections to control cholesterol, we could be looking at the future of how all disease will be treated. There is nothing called caution here. There is nothing called caution. So A is ruled out. He is only telling here that this is a unique system mechanism that aims to disrupt the delivery of messages sent out by a gene. Disrupt the delivery of messages sent out by a gene that can cause illness. In the case of cholesterol, of the protein PCSK9, it doesn't touch the gene itself. An idea about which people do get nervous. People get nervous. People get panicked. People get worried because they feel they are afraid of something might happen. And it bears no relation to things like gene editing, which also get a bad press. People say bad press means word to mouth, word of mouth goes from one person to another person. Bad press means publicity. Bad press means publicity. People talk about it badly, negatively, based on their nervousness. Okay? They're not confident. They're nervous. Nervous because they don't have an idea. They're confused. They're in chaos. They don't have a clear picture. So they talk whatever they know. And it is, they're giving a bad press, means negative advertisement, negative publicity. Bad press means negative publicity. People who are nervous, they give bad publicity, negative publicity, because they don't have clear picture. If they know everything 100%, they give good publicity. They'll talk perfectly. They say, I don't know, but this may create negative impact on our future. They may say anything they want because they don't have clarity in the subject. They do clarity in the subject. So that's why they speak whatever they want, because they are nervous about, they're confused, they are agitated, they're worried about this mechanism. People are worried about the mechanism. They talk what all nonsense they want, rubbish they want. So they give a bad publicity. Okay. So that's what he's telling. So think about this one here. Yeah. Did you give the answers? Yeah. The right answer is here. Question number 36. A, B, C. Logical reasoning approach. Yeah. So this is the answer. Yeah. See the answer there and update your scores. So what I taught now, go and try to do your sessions and apply this technique. Don't ask Simon sir to solve every question of this sort. Apply these techniques there. Apply these techniques there. Okay. If you get 6 out of 6 in part B, part C, this question, 6 questions, 6 out of 6, that means you'll get A grade. If you get 5 out of 6, that means you will get a B grade. If you get 3 out of 6, that means you will get a C plus. So be careful with these points. Okay. Be careful with these points. Learn the techniques. What all techniques I taught. See, watch again. And how Simon sir is applying these techniques. You can make use of these things. Okay. It's past lunch time. I thought I'll finish all these 6 questions. Okay. People don't have time to learn all these things. Now, don't just sit silent and don't expect more questions. Go and do these questions, because in the afternoon, sorry, evening, I'll take part B, part C reading. Part C reading. Yeah. Part C reading. Yeah, Meera, select one part C authentic material, which we have not explained recently, part C. And let me know so that I can take the session in the evening. Yeah. And I will invite everyone to attend this session. They will not attend, but it is our duty to do it. So even if 2-3 students come, no problem. We'll go on doing with the work, because it's very important. It's ourselves. We have to do it. Even if we don't do, these 3-4 students also will miss. I don't want those students to miss. So let them attend at least. Those who cannot attend, let them watch in the YouTube. Yeah. Yes, coming to the point. So, share your experience, what you learned. It's lunchtime. I have to bother about myself today. What should I eat? Yeah, it's already past 2, almost quarter past 2. So we're going to have a break. Share your experience. Was it useful or not? What did you learn? And go and practice these sentences, practice these questions, apply these techniques. Okay, so that you can enhance your skills. I told you that is different. Now you have to learn applying these techniques. Right. So reading part C. Now it is 2:15. So can we take it at 5 p.m. or 6 p.m.? I'll start at 5 p.m. or 6 p.m. Okay. Reading part C. Reading part C. Full extract I will take 8 questions. So don't miss the show. Don't miss the show. Yeah. 5 p.m. or 6 p.m. 6 p.m. Mostly likely if I miss 5 p.m. it's 6 p.m. That's all. Do not miss. And night 9 p.m. is writing. Yeah. Now after lunch there are individual classes. Exam going students. Anybody is there here? So you can get your letters corrected and your speaking sessions done.